Hello everyone, myself Hitesh Shahare, working as an assistant professor at Shriman Sridhar College of Pharmacy, Chandwad, Nashik. Today here I am going to discuss some part of anti-cancer agent. So as we are knowing, the cancer is abnormal growth of cell. Each cycle grow through the different phases, and these different phases are having certain checkpoints. If these checkpoints are damaged by certain deregulation or regulation of genes or the signal that corrupt the checkpoints, and that may lead to the continuous growth of that particular phase, and that may lead to the abnormal growth of cell. So here we are going to see the classification of anti-cancer drug based on their chemical structure. So the major class of the anti-cancer agent is alkylating agent. That alkylating agent are again subclassified in nitrogen mustard, nitroso urease, triazenes, Alkylsulfonate, and platin analogues. The example has been listed over here. Another chemical class as antimetabolite, which is subclassified in purine antagonist, pyrimidine antagonist, and folic acid antagonist. Some antibiotics are also used here as anti-cancer agent. Example: dactinomycin, daunorubicin, doxorubicin, and others. Mitotic inhibitors, these are the drugs obtained from the natural source, from the vinculcloide, vincristine, vinblastine, and others. Some of hormones as well anti-hormones are used as an anti-cancer, like estrogen, androgen, anti-estrogen, anti-androgen, glucocorticoids, aromatase inhibitors, peptide hormone inhibitors, signal transduction inhibitors, and many more. Monoclonal antibodies used as anti-cancer, example rituximab. Some miscellaneous drugs such as hydroxyurea, asparginase, and others used as an anti-cancer. So here we are going to discuss the alkylating agent, antimetabolites, and some of kinase inhibitors in short. So take a look on what are the alkylating agents. These are the electrophilic molecules which covalently modify the nucleophilic molecules in the cell. These are used for both acute as well chronic hematologic malignancies. The mechanism of action of this alkylating agent is initially they generate a highly reactive carbonium intermediate which attack on electron rich site of DNA, such as the nitrogen 7, oxygen 2nd position, oxygen 6th position of the guanine moiety, and the nitrogen 1, nitrogen 3, and nitrogen 7 position of adenine moiety. Certain common adverse effects are there for these alkylating agent. These are marrow toxicity, lung, cardiac, endothelial damage, pulmonary fibrosis, nephrotoxicity, and others. So this is what a DNA strand. When alkylating agents are used, they cause there is a intra-strand linking, that is a cross linking, and that may result in rupture of DNA strand. So first subclass of alkylating agent is nitrogen mustard. They inhibit the cell reproduction by binding irreversibly with the nucleic acid at the N7 position of guanine in DNA strand. They cause alkylation, and that alkylation leads to the alteration of guanine so that it forms an abnormal base pair with the thymidine. The cleavage of imidazole ring of guanine that destroy the guanine ring. Linking of guanine pairs which produces the cross-linked DNA strand, and that cannot replicate further. So the depurination of DNA cause actual breakage of the DNA strand. So example here, the meclorithamine, which is given by intravenously in treatment of Hodgkin disease. Hodgkin disease is the type of lymphoma which is a blood cancer and start in the lymphatic system. Another example is cyclophosphamide. See, in the both of structure they contain CH2 CH2 Cl. that is a common part of this. Cyclophosphamide is given by oral route. The liver form of the drug is twice active than that of dextro form. This is a prodrug which requires the activation by the enzyme, and it is used in the treatment of non-Hodgkin lymphoma, breast cancer, carcinoma of lung, cervix and ovary. Non-Hodgkin lymphoma is the cancer which starts in the white blood cell called lymphocytes. Another example is a Melphalan that is given by oral as well by IV route. It is used in the treatment of multiple myeloma, breast cancer and ovarian cancer. Chlorambisil is again one of the most important drug which is given by oral as well IV route. It is used in the treatment of Hodgkin disease. Thiotepa is another example of this nitrogen mustard. It is converted rapidly by liver enzyme to its active metabolite triethylene phosphoramide, which is a source for aziridinium cation for further alkylation, and it is used in bladder cancer, ovarian cancer and breast cancer. Another subcategory of the alkylating agent is nitroso urease, that again act by the same. It involves the abstraction of NH proton, which is followed by the rearrangement to give isocyanate and a diazohydroxide. The diazohydroxide on protonation, it follows the loss of water and yield a diazo species which decomposes to a reactive carbocation, and that carries out this DNA alkylation. Example carmustine, lomustine. Another category is here triazine. The example are procarbazine, dacarbazine. Coming to the another subclass of the alkylating agent is Alkylsulfonate. The example is busulfan. This drug reacts with the two neighboring guanine residues in DNA, which cause the cross link only within the same DNA strand, not between the opposite strand. Busulfan undergoes sulfur stripping. It is given by oral as well IV route. The subclass of alkylating agent is platinum compound. So these are the drugs which contain the metal in drug. So platinum is used. Metals are very selective toward the target. This platinum considered as a soft electrophile. It forms the complex. So this soft nucleophile containing thiol groups attack on this thiol groups which are found on the proteins, and that result in significant protein binding and inactivation. This Cisplatin given by intravenous route. It is used as a first drug choice for the testicular, ovarian and bladder cancer. So this is what the Cisplatin structure which bind to the nitrogen atom of guanine, which inhibit the DNA, RNA and protein synthesis. Another class of anticancer agent, that is antimetabolites. These antimetabolites are the S phase specific drug which are structural similar to that of essential metabolite and so interfere with the DNA synthesis. They interact with the enzyme and damage to the cell by substituting for a metabolite normally incorporated into a key molecule. They compete with the metabolite for occupation of the catalytic site of the key enzyme. They compete with a metabolite that act at an enzyme regulatory site to alter the catalytic rate of the enzyme. Myelosuppression is the dose limiting toxicity for the all class of drug. So first subclass of the antimetabolite, that is folic acid analogues. So methotrexate is one of the example which is similar to that of folic acid. Now on the screen you can see the structure of folic acid which contain the pteridine ring, para-aminobenzoic acid part and glutamic acid part. Similar to that, methotrexate structure is prepared, drug is prepared over here, that para-aminobenzoic acid, that amino group NH, that is replaced with the CS3 here in case of methotrexate. That is the change is over here, and having the similarity in structure. So, there is a competition between the folic acid and methotrexate. Methotrexate is actively transported into the mammalian cell and inhibit DHFR, that is a dihydrofolate reductase, the enzyme which normally convert this dietary folate to the tetrahydrofolate and form the purine moieties which are required for DNA synthesis. So, these drugs are used in a tumor, breast cancer, testicular cancer, rheumatoid arthritis also, and many more. Side effect: the myelosuppression is one of the major common side effect. Bone marrow suppression, thrombocytopenia, alopecia. So, here one flow chart which you can see the methotrexate inhibit this DHFR, which is responsible for converting dihydrofolic acid into the THF, and the THF is required to synthesize a DNA. So, once the DHFR is inhibited, there is no further conversion of dihydrofolic acid to the tetrahydrofolic acid, and so no more availability of tetrahydrofolic acid. So, no more further synthesis of DNA and no more survival of cell. Another subclass of the antimetabolite, that is the purine analog. The design of antimetabolite based on the purine structure that begins with the isosteric thiol sulfhydryl group, which replaces the 6-hydroxyl group of hypoxanthine and guanine. If we see the mode of action of the purine analogs as antimetabolite, they inhibit the biosynthesis of purine nucleotides or change them to form the interfere with normal cellular function such as synthesis or function of nucleic acid. The example for the purine analog as 6-mercaptopurine, it is written as 6-MP. The ribose diphosphate and triphosphate are active enzyme inhibitors. The triphosphate form is here, which can be incorporated into DNA and RNA to inhibit the chain elongation. It is given by IV route. Another example is 6-thioguanine. So, this is the structure of simple purine, the purine which contains the thiol group at the 6th position. So, it is known as 6-mercaptopurine. Another subclass of antimetabolite, that is the pyrimidine analog. They inhibit the biosynthesis of pyrimidine nucleotide or change its form that interfere with the normal cellular function, synthesis, or the you can say function of nucleic acid. The example to this class is fluorouracil, 5-fluorouracil, which is analog of thymine, in which the methyl group is replaced by a fluorine atom. You can see in the structure it has two active metabolites, 5-DUMP and 5-DUTP. 5-DUMP inhibit thymidylate synthetase and prevent the synthesis of thymidine, which is a major building block of DNA. 5-DUTP is incorporated into the RNA by RNA polymerase and interfere with RNA function. This drug administered intravenously. These are used to treat various solid tumors, breast, colorectal and gastric tumors. They produce the synergistic effect with the other cytotoxic agents such as cyclophosphamide, methotrexate, cisplatin. The side effect as myelosuppression. Another example is cytarabine, which is given by oral route, intravenous route and subcutaneously. This is a structure for cytarabine. It is having narrow clinical spectrum and it is used in combination with other antibiotic, daunorubicin or other cytotoxic agent, that is thioguanine. So, the common side effect is myelosuppression. Another example is floxuridine, which is a pyrimidine analog here again. It is also known as 5-fluorodeoxyuridine, which is administered via an artery. It is used in the treatment of colorectal cancer. This is the structure for that floxuridine. Another chemical class of these anti-cancer agent, that is the kinase inhibitor. These are the large group of potent endoplastic agent which specifically target the protein kinase, which is a extracellular receptor. These inhibitors which inhibit the protein kinase act by binding to the intracellular enzyme tyrosine kinase of the EGFR, epidermal growth factor receptor, and block the signals which are triggered by these kinase from the outside or inside of the cell. The example imatinib, erlotinib, gefitinib, these all are the tinib molecule which belong to the quinazoline moiety. So, this is all about the sum of anti-cancer drug as per Pune University syllabus for the third student. Thank you.